Hello, good evening. There has been a huge increase in compensation payouts following medical negligence claims in Kent and Sussex. Our NHS trusts paid out more than £38 million during the last financial year.
Well, that is double the amount that they were paying out 7 years ago, leading some experts to express concern that no-win, no-fee lawyers are creating a compensation culture that's spiralling out of control. Simon Jones reports.
Selina Monday from Ashford in happier times, but she threw herself off a motorway bridge just 3 days after being released from a psychiatric unit. The Kent and Medway NHS and Social Care Partnership admitted an opportunity to prevent her death was missed. Her family have received a payout of £150,000 for the financial loss they suffered.
It certainly wasn't a decision I took lightly. In fact, it's probably one of the most complicated decisions I've ever had to take in my life. I feel that there was a catalogue of errors, and that's the main reason that I took legal action, and to be able to get the answers that I needed.
In 2003-04, there were 187 claims made to hospital trusts in Kent and Sussex, with more than £15.8 million paid out that year in compensation. In the last financial year, claims totaled 368, with the amount paid out more than doubling to more than £38.6 million. Claims against hospitals are handled by the NHS Litigation Authority. It has said escalating charges from no-win, no-fee solicitors are hitting patient care, as payments ultimately come from NHS budgets.
If you've only got a finite amount of money, what goes out in compensation has to come from somewhere else. And all of us involved in the delivery of healthcare would much rather see that money being diverted into high-quality care.
This Canterbury solicitor says no-win, no-fee cases have opened up justice, particularly for parents.
If such huge sums have to be paid out ultimately, why isn't there a bit of joined-up thinking at play here, whereby if that money were redirected into frontline services and you had more consultant obstetricians available on call to deal with difficulties that arise in childbirth, then everyone would be happier, including the taxpayer, and very much including my clients, because I can tell you, and you can well imagine, my clients would rather have a healthy baby than all the money in the world.
Unlike the case of Brett Monday's wife, the Department of Health points out the vast majority of patients receive safe and effective care.
Simon Jones reporting there. He joins us from Maidstone Hospital now. And Simon, I understand that the whole process of medical negligence cases could now face a shake-up.
Well, 7 years ago, this trust paid out £1 million in compensation cases. Last year, that figure had risen to over £8 million. The trust says that's down to courts imposing higher settlements because of higher cost of living, and also the increase in no-win, no-fee solicitors. But that could be the way forward, because the government wants to axe legal aid completely for medical cases like this. That would mean they would have to be taken on by these no-win, no-fee solicitors. And the fear is they would only want to get involved with cases they feel they are certain to win, and that could leave, according to critics, the most vulnerable people who need money and need compensation missing out on justice.
OK, Simon, thank you.